Hi, my name is Chloe and I'm going to be giving you some top tips to help keep your child's teeth clean and healthy. By this age, your child should have their full set of 20 baby teeth present. At around 6 years old, the adult teeth will begin to appear and push from under the baby teeth, making them wobbly and loose and eventually fall out. Watch out for the back teeth coming through and make sure these also get brushed. This will continue until all the adult teeth come through at around 14 years old. Some adults by the age of 18 to 21 will have wisdom teeth that come through. We encourage you to start brushing your child's teeth as soon as their first tooth appears, at least twice a day, once before bed and at least one other time in the day. It is advisable that after brushing before bed that your child does not have any other food or drinks other than water, as this can lead to dental decay. We encourage parents to support brushing their child's teeth and teach them to learn for themselves. It is advisable that parents should help with those hard-to-reach places until around the age of 7. Make sure you are still using a toothbrush with a small head. You can use an electric brush if you like, but a manual brush can be just as good with the correct technique. We advise brushing your child's teeth with a pea-sized amount of toothpaste containing more than 1,000 parts per million fluoride. Family toothpaste contains 1,450 parts per million. To use this is acceptable. To find the fluoride levels, look on the side of the toothpaste box. It is important to brush each surface of your child's tooth as thoroughly as you can, ideally for 2 minutes. Following the diagram on the screen, focus on these 4 areas. Number 1. Outside, place the brush at an angle along the outer gum line. Brush gently in circles and repeat for each tooth. 2. Inside, repeat in technique on step 1, brush the inside surface of each tooth. 3. At the back of the mouth, brush the chewing surface of each tooth. And 4. Behind the front teeth, use tip of the toothbrush to brush behind each front tooth, both top and bottom. We know this can sometimes be a battle, so feel free to find creative ways to keep your child entertained, like using their favourite video or song. Some brushes come with flashing timers, or a sand timer to show them the length of time they should be brushing their teeth. There is an app called the Brush DJ that provides a 2-minute timer to music. This app also has short videos showing how to brush your child's teeth. Some of your child's favourite cartoons may have a dental episode for them to watch. Try to encourage children to spit out their toothpaste rather than rinsing out with water or a mouthwash. Rinsing gets rid of the fluoride, which stops it working. Ideally, sugary foods should be kept to a minimum or given straight after a meal, as this minimises the number of sugar attacks on your child's teeth. Group eating is better for your teeth than snacking. For example, it's better to have your meal with a juice and a pudding in one sitting rather than spacing these out over the day. Every time we eat, the bacteria in our mouths turns the sugar into acid, and this attacks your child's teeth and causes decay. Avoid sugar between meals where possible, or try sugar-free alternatives. When shopping to find healthier and reduced sugar food and drinks for your child, the NHS Food Scanner app is a great tool to use. This helps to identify these for you rather than you spending more time in the shops reading all the packaging. There is also a traffic light system on packaging for food and drink that makes it easy to identify high sugar food and drinks. The sugar limit guideline for children aged 4 to 7 years is 19 grams of sugar per day. 1 rounded teaspoon of sugar is about 5 grams of sugar, so that is about 4 teaspoons of sugar per day. It is recommended to avoid sugar-sweetened drinks and minimise food with sugar added to it. Between meal times and the hour before bed, children should only drink plain milk or water, and when using medicines, always ask for sugar-free. Here is a sugar board with a few examples of food and drinks you would typically give your child as a treat at this age, and a rough estimate of the value of sugar they hold. 4 grams of sugar equates to 1 cube. Aim to register your baby with a dentist and visit them as soon as your baby's first tooth appears, or at least before their first birthday. We know it can be quite difficult to find a dentist, but make sure you are on as many waiting lists as possible, and you will be contacted when your child reaches the top of the list. For help to find a dentist, Dental Choices is a website designed to make it easier for you to find and register with an NHS dentist. If your child is having pain, problems or suffered trauma with their teeth, contact dentalchoices.org or NHS 111 for help and advice. Once you are registered with a dentist, make sure you attend for regular visits. It's free for children up until they are 18 years old, and it's a good habit to get them into from a young age.
So let's remember, number 1, brush their teeth twice a day. 2, register with a dentist and visit every 6 months. And 3, avoid sugar between meals where possible.
Don't forget to share this information with your family and friends. And that's everything from me and the Locala Dental series. We hope these videos have helped you by providing some top tips to look after your child's teeth. Thanks for watching.